I've had osteoarthritis of the knee for about 8 years.
4 years.
15 years.
7 years.
5 years.
I've tried injections, physical therapy, over-the-counter medications.
I've got MRIs and injections with mixed results.
When you have the pain that you get in your knees, when you see, your family doing things that you can't really participate in without being in pain, I was very angry within myself, very frustrated that I would try to do things and it was so painful.
My doctor explained to me something we haven't tried yet, and he explained the pros and cons, and he felt good about it. And he said it's called Zilretta.
My doctor told me about Zilretta, and I was so excited to try it.
My sister Sandy had a Zilretta injection, and it had really worked out for her. And so I talked to the doctor about it, and he had had the injection himself. So I was more than willing to go with Zilretta.
Both of us have diabetes.
Our doctor felt like Zilretta would be a great option for us.
I found out that Zilretta can last about 3 months.
He said that it was time released and that there was many patients that have been very successful with this.
I had my doubts, but I said, well, Doc, let's go for it. Zilretta has introduced me to much less pain. And I'm happy with how Zilretta has worked for me.
Indication and important risk information. Zilretta, triamcinolone acetonide extended-release injectable suspension, is an extended-release corticosteroid approved to manage osteoarthritis knee pain. It is not intended for repeat use. You should not receive a Zilretta injection if you are allergic to corticosteroids, triamcinolone acetonide, or any other component of the product. Possible side effects of corticosteroids that could occur with Zilretta include rare serious allergic reactions, effects in the injected knee such as infection, with pain, swelling, and restricted motion, or joint damage, increased chance of getting an infection, and a decreased ability to fight an infection. Effects on hormone production. These effects can be reversible. Elevated blood pressure, sodium and water retention, and potassium loss. Intestinal perforation if you have certain gastrointestinal disorders. Weakening of bones. Changes in behavior or mood disturbances. Increased pressure inside the eye. In multiple clinical trials, the most common side effects seen in people taking Zilretta were joint pain, headache, joint swelling, back pain, sore throat and runny nose, upper respiratory tract infection, and bruising. Before receiving a Zilretta injection, tell your doctor about all the medications you are taking, including both prescription and over-the-counter medicines, and about any medical conditions, especially if you have high blood pressure, heart disease, ulcers, diverticulitis or other gastrointestinal disorders, kidney problems, diabetes, glaucoma, behavior or mood disorders, and/or infections. After receiving a Zilretta injection, tell your doctor if you develop a fever or other signs of infection, have an increase in pain along with swelling of the injected knee, restriction of joint motion, or a general feeling of discomfort. Contact your doctor immediately if you are exposed to chickenpox or measles, or for any new or worsening changes in behavior or mood. These are not all of the possible side effects with Zilretta or corticosteroid medications. Please see the full prescribing information at www.zilrettalabel.com. Always contact your doctor if you have questions or experience any side effects. You are encouraged to report side effects to the FDA. Call 1-800-FDA-1088 or visit www.fda.gov/medwatch. You may also report side effects to Flexion at 1-844-FLEXION. Ask your doctor about putting the Z in your knee. Zilretta.